Hello, everyone, and welcome to our Let's Talk Health. I am Mariele Landrom, aka Miss Let's Go, your lifestyle coach.
And I'm Stephanie Cudjoe, family medicine physician at BloomMed in McKinney, Texas.
And this is the season where a lot of people are really getting sick. So our topic today is talking about the flu and what needs to be done to kind of prevent and help you to not get the flu.
Sure.
Right?
Yes, absolutely. So there's a lot of the last 2 years, we've had some pretty big flu seasons, right? And I don't want to jinx anything, but it's been pretty quiet this year, which is really nice. But we wanted to kind of go through just some basic information that might help during this flu season. Number one, hand washing is imperative. We are here in McKinney. There's a lot of kids, and there are a lot of kids doing a lot of activities together. There are, these trampoline parks, and, you've got your sports activities and lots of birthday parties, and, you're constantly seeing this. So, we want to make sure hand washing is encouraged. That is like what the number one.
Not like hand sanitizer.
Not hand sanitizer.
Right? Oh, okay. I just had to throw that in because a lot of times, we just try to put the hand sanitizer.
Yeah, if that's all you have, then, it's better than nothing. But there is no substitute for hand washing. And so, we want to make sure that we, of course, encourage that. Before you even get to more controversial interventions to help with flu, just make sure you're washing your hands.
Yeah.
That is the number one disease preventing action that we can do.
Yeah.
But some other things, though, that we can do is avoiding touching our face. If you have a cold or cold symptoms, runny nose, coughing, whatnot, that you would cover that, and preferably up here in this area. So kind of keep it with you. Yeah. And we don't want you to necessarily share that gift with the rest of the population.
Right. Say that one. We'll take another gift, but not that kind of gift.
We'll say, you can keep that one for yourself. And so, we ask that, of course, everyone would be considerate of others, especially when you're in confined spaces, like in the elevator or in the line somewhere. If you feel it coming on, you just step out of line and take care of what you need to take care of, and then you can. I'm sure they'll let you come back in. So just some, just basic ideas on how to decrease or help not spread what you have. The other thing is, for fever, if you have a fever, please don't medicate your child and send them to school. If they have a fever, they're not feeling well. Kids tend to be very resilient. They have lots of energy, and it can be, as a parent, I understand that it can be frustrating because they have a fever and yet otherwise they are behaving like their normal selves. But that would, if they have a fever, the risk of them spreading whatever it is that they have, whether it be strep or some viral infection, including flu, is extremely high. And so we do ask that you would keep them out of school and other extracurricular activities for 24 hours from their last fever. So you can still give them Tylenol, whatever, but they need to be fever-free without the use of fever-reducing medicines for 24 hours before you bring them back into the general population. And again, if we are training our kiddos and our parents to do those first things, then that would decrease the frequency with which we would need to keep them out because they actually got something.
Right.
So, all of that being said, we do have flu shots available.
Okay.
They are out. They've been available since the end of September. Flu shots are still effective for decreasing the flu, or if you do get the flu, of decreasing the severity and the duration of symptoms. But the biggest question that everyone wants to know is, but do I have to get the flu shot? I thought there was one that's a nasal spray. Can I get that one? And things of that nature. So really, we want, for sure, we want to immunize our patients that are at increased risk of having an untoward result of having a flu infection. So those that are tenuous, our elderly, those that are homebound, our babies, pregnant women, those who are have a suppressed immune system for whatever reason. Either they're taking chemotherapy, they have just an innate immune deficiency. So those that would, if they got an infection, they wouldn't be able to fight it as hard as someone with a normal immune system. Those are the ones that we preferentially will ask, to get the flu shot. And also with that, there are certain chronic conditions like diabetes that do suppress the immune system, and that if they were to again get the flu, it would be harder for them to fight it off, and that could lead into a hospitalization that could end in not so good effects. So those are the ones that we especially want to make sure that we give the flu shot to. Now, the general rule is that everyone could benefit from a flu shot, though. So there are folks, for example, I have an egg allergy. I was told I couldn't get the flu shot. So literally this year, the recommendation is that even those with an egg allergy who broke out in hives when they had egg are still able to get the flu shot, but they just need to be monitored. So just know that there are policies now in place with which the physician's offices have to follow so that we can do it safely. If they are up to 4 years old and have asthma, then they are not eligible for the non-shot but the nasal vaccine. Okay. After age 4, though, then they are able to do that 4 or 6. Then they're able to do that even if they have asthma. Again, another situation where if they were to get a respiratory infection, it could potentially send them to the hospital. So there are certain populations that we definitely want to immunize. We would love for everyone to get the flu shot. If you're a healthcare worker, of course, and that puts you at increased risk of having a higher degree of exposure, just the frequency, because you're seeing folks that are sick. Right. You need to get your flu shot. I get my flu shot every year. So, and it's okay. If you've had, the only contraindication is if you've had Guillain-Barré, which is a neuromuscular condition where you have paralysis that came up your legs. You don't get that. You don't get the vaccine. That's all you have to say is Guillain-Barré to say, okay, never mind. Yeah. It's okay. But for the far majority of other patients who have a healthy immune system, they do not have to have the flu shot. They can get the benefit of having a flu shot, but it's not absolutely required. Okay. So I wanted to make sure that was pretty clear. Good point, because I know as healthy people, we'd be like, I don't need that, I don't need that. I'm okay. Fight it out. No problem. Of course, staying hydrated, getting a good night's sleep. Those are all things that will help foster a healthy immune system to work even better if they were to be exposed to infection, right? So if you don't sleep, if you're constantly taking the red eye back and forth, if you're traveling a lot, which could increase your flu exposure, you should get a flu shot, right? So, we want to make sure that we're using some common sense when we're talking about flu vaccines or not. There is no reliable evidence that says that the flu vaccine increases risk of autism and things of that nature. I know that that's also a very big concern, especially in communities where there's a lot of kids. So we want to go ahead and just dispel that. Recognizing, of course, that autism is something that no one wants to have to diagnose or deal with. If possible, if we can prevent that, of course, we would love to do that. But it has not been proven that that is in fact a risk factor. Okay. So we just want to make sure that we keep you armed with good information to keep you healthy this flu season.
Yes, absolutely, because you don't want it to take you down, because it will.
No, absolutely.
So let's be on the preventative side.
Absolutely.
Well, thanks again, Doc, for that information. So if you have not gotten your flu shot, or you're not doing some of those things like washing your hands, let's start implementing that. And as always, thanks for joining us, and join us next week on our Let's Talk Health.
Bye.
See you guys.